We're ready to start whenever you're ready. We do have quorum.
Okay, great. Thank you. Good afternoon, everyone. Welcome to the Regional Domestic Violence meeting. Let's call the meeting to order. This meeting is being recorded and live streamed on YouTube as a way for members of the public to participate. I will ask that you please keep your microphones on mute when you are not speaking. And for the purpose of the meeting minutes, I ask that you state your name before any comments. Kelly, can you
I'd be happy to do roll call, Chair.
Yes, please. Thank you.
Certainly. Celeste Adams. Zach Altman. Lupe Bandine.
Present.
Joshua Clark. Christine Ellis. Vice Chair DC Ernst.
Present.
Gary Friedel. Cindy Garcia.
Present.
Laura Guild.
Present.
Christine Hahn McDonald. Elizabeth Herbert.
Present.
Samantha Hinchy. New council member Burdetta Hodge. Laura Gill.
Present.
Mary Lynn Kasanick.
Present.
Stephen Miller on behalf of Trish Clark.
Present.
Elizabeth Herbert. Present. Heather Bonet on behalf of Andrew Lefevre.
Present.
Thank you. Lieutenant Chris Sund on behalf of Rick Levis.
Present.
Thank you. Kevin Mattingly.
Present.
Thank you. Amy Offenberg.
Present.
Mayor Bridget Peterson.
Present.
Thank you. Rachel Sanders. Chris Charlow.
Present.
Thank you. Sergeant Kelly Shore.
Present.
Thank you. Melissa Thomas.
Present.
Thank you. Brandon Wilson. And Chair Norton.
Present. Thank you.
Thank you. Did I miss anyone? Thank you, Chair.
All right. Thank you. We will now move on to the call to the audience. And please note that members of the public were given an opportunity to submit written comments relating to this meeting to azmag.gov/comment within 1 hour of the posted start time for the meeting. Kelly, has staff received any comments from the public?
No, Chair, we have not.
All right, thank you. Before moving further, and we had their introductions earlier, but I'd like to take a moment to introduce our newest committee members joining us today for the first time, our Tempe Council member, Burdetta Hodge, Cindy Garcia from CPLC, and Lieutenant Chris Sund from the Phoenix Police Department. Welcome and thank you for joining us. Okay, next we need approval of the June 2nd, 2022 minutes. Is there a motion to approve the meeting minutes?
I'll approve them. This is Mary Lynn.
Do we have a second?
Kevin Mattingly, second.
Okay, thank you. Is there any discussion before we take the vote?
Chair Bandine had her hand up, or excuse me, Councilmember Bandine had her hand up. Was that to second, Councilmember? Yes, okay. I don't see any other signals, Chair.
Oh, okay, great, thank you. Please indicate your vote with a yay, nay, or abstention. Kelly, please conduct the roll call vote.
Lupe Bandine.
Yay.
Thank you. Vice Chair Ernst. Yay.
Sorry, I lost control of my mouse. Yay.
That's okay. Cindy Garcia.
Yay.
Thank you. Laura Guild.
Yes, yes.
Thank you. Christine Hahn McDonald. Elizabeth Herbert.
Yay.
Thank you. Samantha Hinchy. Burdetta Hodge.
Yay.
Thank you. Mary Lynn Kasanick.
Yay.
Thank you. Stephen Miller on behalf of Trish Clark.
Yay.
Thank you. Heather Bonet on behalf of Andrew Lefevre.
Yay.
Thank you. Lieutenant Chris Sund.
I abstain. I wasn't here for the last meeting.
Thank you. Kevin Mattingly.
Yay.
Thank you. Amy Offenberg.
Yay.
Thank you. Mayor Bridget Peterson.
Yay.
Thank you. Rachel Sanders. Chris Charlow.
Yay.
Thank you. Sergeant Kelly Shore.
I'll go ahead and abstain 'cause I wasn't here for the last meeting either.
Thank you. Melissa Thomas.
Abstain. I wasn't in attendance for that June meeting.
Thank you. And Chair Norton.
Yay.
Thank you.
Thank you. And we'll now hear updates from the 2 new domestic violence work groups. And we'll start with the Teen Dating Violence Work Group. Vice Chair DC Ernst, the floor is yours.
Thank you, Chair Norton. I appreciate that. Good afternoon, everybody. I figured out how to unmute myself that time, so that was pleasant. So we've had a couple of meetings for the domestic violence team dating workshop. Unfortunately, we did have to cancel our last meeting. But what we are looking at is trying to identify partners to participate in this committee with us and work group with us. We're looking at themes to present in the future. And actually, hold on just a second, because I just want to make sure that I am okay. We're looking at themes to present in the future to council regarding local resources, how we can identify current education that is out there that is free or low cost to schools, that we can make recommendations for engaging, how we can engage our refugee population, making sure that we're including resources that are bilingual, and then looking at how we can get, I think I already said this, other community members involved in this, as well as hopefully engaging some teens to participate in this. So we are meeting, I think every other week. Is that correct, Kelly? Yes, thank you. I got that right. So we're meeting every other week on Monday at 3 p.m. and I would be happy to answer any questions, and we would also be happy to have others join our group as you are able to. So with that, I'll open it up to questions.
Vice Chair, do you mind if I add a few things?
Not at all. You are so helpful in all of this. I really appreciate you. Yes.
My pleasure. One of the themes that we've heard in these work group meetings over the last few weeks has been the support of a curriculum for schools to try to prevent teen dating violence before it begins to occur, and to provide youth with the skills they may need to identify teen dating violence if they don't currently understand that it can be more than physical violence, for example. And so we have reached out to Bloom 365. They are a local provider of, they specialize in this work, and they will be participating in our work group moving forward. So we may be able to use the curriculum and the contacts they already have in place.
Thank you so much. Some of our members are also with Care 7 with the City of Tempe, and they've also offered to show us curriculum and the outreach that they do in their community to help us not have to rebuild a wheel that already exists. So I appreciate that. And finally, in my notes, I also showed that one of the other areas that we're going to target is the medical community, pediatricians, behavioral health as well, to see if we can get them involved in the workshop and helping us get out the word on this concern, and help us see how we can positively impact it, so we can hopefully prevent domestic violence in the future. So I'll open it up again to any questions, and if we don't have any, I will turn it back over to Chair Norton.
Thank you. Are there any questions or further discussion on this?
Hi, this is Christy McDonald. I apologize for not answering earlier. I was having technical difficulties with my being able to speak, but one thing I wanted to make sure, you said you guys are meeting every other Monday. I couldn't make the last meeting. So can you make sure, I don't know that I've seen anything regarding up and coming meetings, but if you're meeting that often, I just wasn't aware. So I don't know if there's some sort of communication that can happen about that.
We would be happy to send out, excuse me, Chair and Vice Chair, we would be happy to send out meeting notices again, and we would be happy to include you, Christy, on the future notices as well.
Thank you.
Hi, this is Councilmember Burdetta Hodge. I just, since I'm new, I would ask if you do the same, send me notices, and can I get maybe a little information to catch me up to par what's going on with it?
Councilmember Hodge, we would be happy to.
Thank you.
And then Chair Norton, if there's nobody else.
Yeah, and I do just want to add also, if there are any other members that have not been at any of the previous meetings, but you are interested, please let Kelly know and she will make sure to give you the notification for that. So the more minds, I think, the more effective we might be. So this is a great work group. And then now let's hear next from the Community College Crisis Workforce Work Group, and Councilmember Bandon, the floor is yours.
Councilmember Bendine, you're still muted. There you go.
Okay, thank you, Chair Norton. So the Workforce Work Group is meeting every 2 weeks on Thursdays. We've had 3 meetings so far. Our core group is about 4 to 6 people so far. We've decided to focus on 4 areas. Our first is researching the need and challenges. So we decided that we would do a workforce survey. So we prepared questions for our workforce survey. The survey questions were forwarded to our list of nonprofits. We tried to focus our questions on the types of positions, the challenges of filling positions, and the requirements of their positions. Our next area is education. So we're working on researching advocacy class offerings at the community college level. We're in contact with Mr. Beverly from the Maricopa County Community College District to provide us with class offerings and to tell us about certificate programs, associate, and perhaps even bachelor degree programs that would promote entry into the field of DV advocacy. So our goal here is to try to prepare a pocket guide for the courses of study. Our next area is outreach, and the workforce group agreed that our outreach efforts should begin at the high school level. So we'll be trying to contact Valley High School groups such as JAG, Jobs for Arizona Graduates, Police and Fire Explorers, Teen Councils about their events so that we can be present to discuss advocacy careers and education pathways. Our next area is publicity. So we've been discussing and planning to provide a video of interviews with advocates from nonprofit organizations and cities to share with the teens and the community about jobs available, the rewards, and the need for supporting DV victims of all ages from teens to seniors. So that's where we're at right now with our crisis workforce group. Do we have any questions?
Councilmember Bendine, may I also add one other detail?
Yes.
We have had,
Yes, please.
we have had 41 responses to our online workforce survey. It's been a really robust response, and we will be prepared to have more details, a better analysis of the data that we've been able to collect from that survey at the next Regional Domestic Violence Council meeting, and further information for the work group the next time we meet.
Great, I'm glad to hear that. And thank you, Kelly, for all your support. And we're a small group, but we're a busy little group. Thank you for your support.
Thank you very much, Councilmember Bandon. Are there any questions, or is there anyone else that would like to participate in this work group that has not yet been to any of the meetings?
I would like to, this is Councilmember Burdetta Hodge. I would like to get more information on it so I can get up to par on it on this one also too.
Okay, all right, thank you. And I think Kelly can do that. So very good. I'm excited to see what will come of both of these work groups along with what we're doing in the general council. Next,
Chair Norton?
yes.
I'm sorry, this is DC Ernst again. Hey, I just want to congratulate that work group. You're doing a fabulous job. That's amazing work. Great job.
Thank you very much. Thank you. Okay, next I would like to introduce Amy Scanlon with New Life Center, who is here to present on the new Sunshine Healing Center. Amy, thank you for joining us. The floor is yours.
Thank you. Thank you for having me. My name is Amy Scanlon. I'm the Outreach Director at New Life Center, and I'm here today to talk about our satellite office that we have opened, which is called Sunshine Healing Services. It's a community-based sexual assault healing center. And if you can do the next slide, that would be great. Thank you. So I think, starting off as recognizing that New Life Center, I believe, has been known in our community for a very long time, for decades, as a shelter and a domestic violence service provider. And so we have spent, since I've been here about 1.5 years, the direction for New Life Center is to really be able to expand our outreach and our mobile advocacy outside of the shelter walls, which has been challenging, especially during COVID, but specifically for folks that don't ever need to enter a shelter or never will need that service. Our mobile advocates for meeting people in the community, meeting at Starbucks, meeting in locations that truthfully aren't psychologically or emotionally safe for folks to really do some tough work. And so one of the goals for New Life Center is to look at finding a space for survivors of sexual violence to be able to go in person, receive services, have a sense of community, and receive different types of healing options at this center. And so that's what we were able to do. And our next video will just give you kind of a visual glimpse. Anyone is welcome to set up a tour. I'm certainly happy to set that up, but we'll just show a little video of the center and kind of what it looks like.
Hi, what you doing here?
Turning my stuff in.
Oh, okay.
So
Next slide, please. Thank you. I don't think I need to tell this group the stats about sexual violence, but one of the, we know that we live in a community that has very strong family advocacy centers and a very strong supportive model for victims and survivors that may want to seek the route through the criminal justice pathway, and that is great. So what we are looking at is the community that has probably been underserved or may not have ever accessed law enforcement and reporting, may choose not to do that, but still need a safe place to land to get their support and their healing. And so our vision is to work collaboratively with our community partners for those that may enter both of our doors or many of the doors to services. But looking at some of these stats, we know that the average age of reporting for someone that was a victim as a child is about 52 years old. Every 68 seconds, someone is sexually assaulted in the United States. The offenders of sexual assault are known to the victims, which we know contributes to the reason for not wanting to report, not disclosing, and not being able to maybe speak up at the time. Of the 1,000 sexual assaults, only 310 are reported to police, which means 2 out of 3 assaults go completely unreported. And it's normal for victims to experience trauma long after the event occurred and need support throughout their lifespan. More than 90% of people who are involved in sex trafficking were also victims of sexual assault in the past. And so when we look at the services in our community, we feel like we want to offer choices for people that may not enter our already existing services and give them the type of services and healing that they need, despite ever reporting, or if this happened many years ago, they still have a place to receive services. You can do the next slide. So we define sexual violence as any sexual activity that occurs without the consent of everyone involved. And this includes sexual activities involving physical contact, non-physical contact, sexual harassment, coercion, and sex trafficking. And I think this is important for us to identify because nothing, again, we don't have to operate at all in terms of defining anything by the law. And so if someone has experienced any form of sexual violence, anything that they perceive as sexual violence, and they're over the age of 18, they qualify for our services at our center, as do secondary victims. So if we have parents or caregivers or spouses or partners who are struggling because someone they know and love was a victim of sexual violence, we can provide secondary care for them as well. All services are voluntary, and folks can come, enter services, exit services, really as many times as they might need throughout the time that that we're available. And so it's not a one-time you receive services and then you cannot come back. And I think the idea about serving throughout the lifespan is probably one of the most important, considering, we looked at that stat earlier that at the average age of disclosing or reporting for the first time is around 52. And so we want to be able to serve people who may have experienced a sexual assault 6 hours ago, and we know how to help support them, get them connected with the services they need, or if it was 60 years ago. So we don't have any timelines or any restrictions regarding that at all. And I think what we're seeing for some folks that are calling is they've done initial work and they received services, they had involvements from the systems and things went fine and they got what they needed, but they still need check-ins or they still need support throughout different points in their life, and we can be a source of support for them. Next slide. The programs that are actually housed out of the center are the Sexual Violence Healing Services. Oops. And I'm hearing myself, sorry. And we have 3 victim advocates who are in this program. One is Spanish speaking. And when we look at kind of still how we're doing our service delivery, the 3 victim advocates also wear the domestic violence hat and will still be providing mobile advocacy and services out in Goodyear, but that we're housed out of the center in Phoenix now. The human trafficking program that we have is also housed out of this center. And again, the case manager is serving people at the shelter, maybe people in transitional housing, come to our center, do programming, and meet their victim advocates and case managers in a location that we just didn't have before because we were a confidential shelter and our outreach clients just couldn't come to us at our facility. But now that we have our facility, they're welcome to do their meetings and their programmings and their check-in there. So it's been really just beautiful to watch in terms of how we're able to offer services in a really different way. Our sexual assault investigation training program is housed out of here. This is Angela Rose's program. And again, that's statewide, so we don't actually do the trainings in our building because it's not large enough for that. but her office and kind of the coordination is occurring out of the center. And then Katie's Way Prevention Program. So I feel like I should probably connect based on what I heard just a little bit ago. It's not my program. This is also Angela Rose's program. And we just acquired a new manager to be under Katie's Way, but New Life Center acquired Katie's Way, which is the formerly the program that did domestic violence awareness, healthy relationships awareness for youth throughout Arizona. And we now have that program. It's still, we haven't even started developing trainings yet, but we did adopt, let's see, Dating Matters through the CDC will be the curriculum that they're using. And so if offline, you want me to get Angela and the training manager together with your program, I think they would be a great resource, and we could work really well together for the youth violence. And one of the things about the program that they adopted for Dating Matters is that there's a curriculum for youth, there's a curriculum for teachers, there's a curriculum for, I think, coaches and parents. So everybody's kind of getting the same language. So parents know what kids are talking about, kids know kind of what the adults know. And I don't know a lot about it. That's as much as I know, but I can get you guys connected. Next slide. So these are the services that, that we offer: case management and advocacy. We're offering groups for sexual violence survivors, also DV survivors. We're hosting the groups out of there as well, both in English and in Spanish. And our groups for our human trafficking program are going to be more survivor-led. So those will look a little bit different, but we do have different types of groups available based on the types of victimization that someone experienced. La Frontera, we have a MOU with La Frontera, and they are providing our full-time counseling to our victims of sexual violence. And we are, again, working really closely with local law enforcement to ensure that if anyone who walks through our doors wants to report and wants help with medical accompaniment, court accompaniment, law enforcement accompaniment, we want to be able to pass people off to the right places and know that that we can meet their needs regardless of it's something that we can do or not. And the other thing that we really want to build within our programming, and we've started, is holistic healing options. So we know that not everyone can do traditional narrative therapy, which is it's absolutely offered at our program. But we have started yoga twice a week or twice a month. We offer that for free. And I'm in kind of negotiations right now with getting an art therapy session started, and that will be once a month. So we will be adding, kind of as we go, different types of holistic healing options for folks that want to do that in conjunction with their groups or their therapy, or if they just want to do the other options, that's fine too. Next slide. This is how people can reach us. We do have a 24/7 hotline, and that is also the number for the center. We have an email address, and if you go to our website, we also have a chat feature now, and our advocates are responding to the chat feature for folks that, probably the younger people that just really don't want to talk. They'll never call the hotline. They're more likely to probably do the chat feature. So those are the three ways that people can reach us and get connected with the services that they need. I think that's it.
Thank you very much, Amy. Are there any questions from the council on this? This is a real important work that they're doing.
Hi, this is DC again, and I absolutely will take you up on that offer.
Okay.
Thank you.
Great. I was really excited when I heard you talk. I was like, it's not my program, but I'll offer them up for sure.
Are there any other questions or discussion? All right. Amy, thank you so very much for this presentation. It's good to hear what Sunshine Healing Center is doing. I do want to ask you one question, and you did answer that you have Spanish-speaking advocates. One of the things I have found is that in maybe in all communities, but I certainly know in El Mirage and communities in the West Valley that there's a population of undocumented women and perhaps some men as well that are victims, and they have a hard time reaching out because of the fear. Is there anything that your program is doing to help reach that part of the population?
Yeah, so one of the human trafficking program coordinator and the victim advocate, we have 2 Spanish speaking, and they're very involved with the Mexican consulate and the activities and outreach that are occurring through messaging. And they do a lot of, I think this week she's got like a radio program that she's going to speak on. So we're getting kind of trying to get the word out there, but also we're so low barrier that the truth is if someone calls or engages with us, we don't have to know anything about them other than, like I said, over the age of 18 and experienced some type of sexual violence. And so if they want to give us a name that they want to give us, that's fine. There's no, we have to collect data just for demographics to make sure that we are abiding by our grants. But in terms of like verifying anything, that's just not our role. And it's a very safe place for people to come.
Good. Very good. Thank you very much. Are there any other comments or questions for Amy?
Yes, I have it. I'm Councilmember Hodge. And Amy, I would love to do the tour also. But also, I don't know, you guys probably already talked about this, but I know that the Super Bowl is coming. Are you guys prepared to take on the amount? Because I know anywhere that the Super Bowl is, human trafficking is the highest at that time. So is there any measurements being taken for preparing for our Super Bowl coming?
Yeah, that's a really good question. So the Human Trafficking Project Coordinator is on the task force with Phoenix and the state and all of there's a lot of people working on this. And so we are absolutely part of one of the service providers that are at the table. We have really big dreams about how we can expand. I don't think we'll be able to do it by the Super Bowl, but we absolutely are part of the discussions and can provide support and services to victims around that time and after the Super Bowl leaves. So we're prepared.
Okay, thank you.
Yeah.
Thank you very much. Any other questions? All right. Thank you, Amy, so much for the presentation. And thank you for, with Katie's Way for the teen dating work group. That's great.
Yeah, that's great. Okay. Thank you.
Thank you. Thank you so much. Okay. Now, next we had on the agenda for Ricky Harrell with Rahab's Daughters to present. However, illness is preventing him from attending. So perhaps we'll be able to get him in another time. So for now, we will have the Domestic Violence Awareness Month 2022 update from Kelly Williams. And Kelly, the floor is yours.
Thank you, Chair Norton. We also have one other addition to our agenda today. My colleague Jody Hector is here from DES with the Abuse in Later Life Grant to give us an update as well. So if you don't mind, Chair, I'd like Jody to be able to go ahead and give her update. And then I have several updates, including information on Domestic Violence Awareness Month, which is October.
Yes, that's great. Thank you. Jody?
Hello, thanks, Kelly. I do have some updates regarding the Abuse in Later Life Grant, which was awarded from the Office of Violence Against Women, the Department of Justice in 2020. We now have over 60 partners. We're growing every month. We're actively seeking out organizations that work with the elderly. We've met most of the grant requirements, including direct service provider training, law enforcement training, and we have collaborated to create what's called the Maricopa County Legal Remedies, it's a long word, and Victim Resources Guide for Elder Abuse, which is a document for mostly law enforcement, but can be used for organizations that work with the elderly as well. So we're also in the process of creating a brochure, a spiral bound version, maybe for the glove box for law enforcement, and a pocket card in English and in Spanish. So I've sent Kelly the PDF and the online versions of those resource guides if you would like to spread the word or look at it, and she will get that information to you. Also, during last month's meeting, we started to discuss the guiding principles of the grant, which are focusing on systems change and review, enhancing victim safety, improving offender accountability, and working collaboratively. So this led to a pretty interesting conversation that we will continue to hold in next week, I believe, to hold more offenders accountable, improve victim safety, and how also to interpret the vulnerable adult statutes so that more offenders will be prosecuted. So if you'd like to join this conversation, it will be virtual next, believe it's next Thursday. Just let us know and we can add you to the list. The law enforcement training is still active. So it is for any officers, investigators, or really any persons that work with the elderly. So there are 26 modules that you can complete at your own pace. I highly recommend this training. There's information on how to collect evidence, capacity, financial exploitation, lots of good stuff in there. So anybody can register, and I'll also include that in the information that Kelly sends out to you. I think that is all the updates that I have as of now. Let me know if you have any questions.
Thank you, Jody. I do have one question. The resource guide that you're putting together, while it's primarily aimed toward law enforcement, have you considered of making it available to the senior citizen community centers? The senior centers.
Absolutely. So there's an online version that's already on the DES website, and there's a PDF. So anybody can use it. It has tons of resources, the statutes, information about elder abuse in there. So it's available for anybody to use, but it's geared towards law enforcement. As you can see, it's like how to collect evidence, how to investigate elder abuse crimes.
Okay, thank you. Are there any other questions for Jody? All right, thank you very much, Jody, for the update. And now we'll hear from Kelly on the mini updates and plans for the Domestic Violence Awareness Month coming up. Kelly, the floor is yours. Thank you.
Thank you. Yes. So as you all know, October is Domestic Violence Awareness Month. Each year, the Regional Domestic Violence Council picks a theme to focus on to bring additional attention to some aspect of domestic violence. This year, the proposed theme is to focus on emotional abuse across all ages, across all ethnicities, etc. The recent data from the federal government shows that 50% of individuals who experience some sort of domestic violence experience emotional abuse. And I do think that we could be bringing more attention to this issue with your support. So I would like to ask, this does not require a vote, but I would like to ask for any feedback on that theme. If you'll remember, last year we focused on older adults in partnership with our grant with DES. We had a press release, we had a survivor come and speak. We do not have plans for a formal press event this year. However, we will still have our calendar of events on our website. We will encourage individuals to wear purple and showcase photos of those who are showing their advocacy by, for example, I know Fountain Hills turns the fountain purple for a couple days, those sorts of photos. We like to promote those and get them out on our social media, and also have a press release focused specifically on local resources to address emotional abuse. Is there any feedback from the council on this topic or this focus for October?
Hi, this is Mayor Bridget Peterson. I just want to mention that from Gilbert's perspective, from last year, we put out a proclamation at a town council meeting. We also will turn our water tower purple. So those would be things that you would be able to see on the Gilbert's social media page. And please feel free to share that too.
Thank you, Mayor. We did last year receive photos of your tower that was purple, and it was wonderful. We really appreciate the support.
It looks beautiful in purple, but I'm a little biased. It's my favorite color. So thank you.
Hi, Kelly. Could I speak up?
Actually, Ron, you're here as a guest. I apologize. So I need you to, I'm happy to discuss anything with you afterward.
Oh, okay. Because I had an idea.
We can connect after the meeting.
Yeah. Okay.
Sorry, it has to do with open meeting law and members of the council.
Okay, so one of the things I wanted to offer, and I don't know if there's any time for us to put anything together through the council on this, but Loopy Bandon had shared with us the video presentation that the city of Tolleson did last year, and theirs was on substance abuse prevention and education. However, the format that they used, I was really impressed with it, and I think it's something that we could utilize in regard to the domestic violence. And I don't know, I'm meeting in 2 weeks with members of El Mirage staff to see how we can put something together for Domestic Violence Awareness Month. But based on what I saw, it seems, I'm not the computer tech, it would have to go to the IT guy, but seems like we might be able to possibly put together some short videos that we can put on our social media, the website, etc., on domestic violence and emotional abuse, kind of, getting some of that out there so that we have more than just the written information, but we have something to kind of that people might be able to see and identify with and say, oh yeah, that's me. So it's just a thought that I have, and I'll share with you what we come up with, and if it's something that we can pass along with the MAG-DV Council, we'll be more than happy to.
Chair Norton, MAG would be happy to support and promote any social media from our members on the council during October. If there are videos or other photos, etc., we'd be happy to send that out through our channels as well.
All right, thank you. Are there any other comments of any other members for this?
Yeah, Councilmember Hodge. I'm going to talk to my mayor of Tempe, Mayor Woods, to see if we get a proclamation out for the month of October for Violence Month. So I'll get that. I'll talk to him on Monday when I'm back in town.
That's also something we can provide a template for, and we can send out to everyone on the group, so you could take it to your city leaders if that would be of help.
Okay, that would be great. I believe, doesn't the governor's office also do a proclamation on domestic violence?
Yes, they do.
During October? Okay, great, thank you.
And I do have one other update that was brought to my attention today that I just wanted to share with you all quickly. We are in the process of applying for our annual HUD grant to help support homeless services across the region. And we have up to $4 million available to domestic violence providers to provide housing options for individuals who may need services. We did not pull those dollars down last year. We did not have any domestic violence providers apply for those dollars, so they remained with the federal government. So if you are working with a domestic violence provider who's providing services or housing options to individuals fleeing domestic violence, and they may be interested in applying for those funds, I would be more than happy to connect with them and have them connect with our homeless team to help them walk through the application.
That is fantastic. Thank you so much. Is there, Kelly, do you have any other updates for us?
I do not, Chair. I did have one other question for the council. I am subscribed to many domestic violence listservs across our region and frankly nationally, and I receive a lot of resources. I do try to send those on sparingly to you all, but if you feel like I'm sending you too many emails or too many attachments, please reach out to me and I can change that, to be frank. I don't want to spam you.
I for one don't consider that spam. I think it can be very helpful and give us ideas on what we can do here in our region. So I appreciate those. Any other comments for Kelly? Okay, then are there any requests for future agenda items or topics of interest to the council? None? I'm not hearing anything. Is that right?
That's correct, Chair, and I don't see any hands raised.
Okay, all right. Are there any comments from the committee? Members are provided an opportunity to share information and updates on information. Are there any other comments or information that you want to share other than what's been shared?
Madam Chair, would I be able to offer something from ACJC?
Yes.
Hello, everyone. My name is Heather. I'm the Victim Services Program Manager here from ACJC. I'm serving as our Director, Andy Lefever's proxy today. And I just wanted to give everyone a heads up. So we are currently working on an automated victim notification project with our local sheriff's offices. So we're still kind of in the early stages of the project. But a part of that is a statewide directory for victim services. So as part of kind of the public facing site, there is a victim services directory. So if anyone is interested, I'd be happy to send out the link. I can put it in the chat or I can send it over to Kelly to pass out. If any agencies are interested in putting their information on the victim services directory, it would be a public directory.
That would be great. Thank you very much. Yes, if you can send that to Kelly so she can share that in email to all of the members, that would be very welcomed. Thank you.
Absolutely. Thank you so much.
Okay. If there are no further comments, then we will adjourn today's meeting. Thank you for attending, and we are now adjourned. See you at the next meeting.
Thank you.
Kelly, do you have the date of the next meeting?
It is the first Thursday of October. I apologize. I don't have my calendar in front of me at the moment.
Okay. All right. And also continue to have a safe summer and try not to get too hot. All right. Thank you.
Councilmember Bendine, did you have a comment?
Anita, were you going to stay on with me for a few minutes? Chair Norton?
Yeah, we can do that.
Okay.
I think we need to make sure that everyone else is off so that it's not part of the regular meeting.
Thank you.
Thank you, Chair.
Thank you. Have a great day. Are you there, Loopy?
Yes, I'm here.
Okay. I saw the video. I was so impressed, and I shared it with Amber Wakeman, our public affairs gal, and then also our communications gal, Carrie. I can't think of her last name, but I thought the format that you did was really well. We had been doing the Elmraj Cares forums where we were doing them in person, in public, in the schools in different locations. But when COVID hit, we brought all that to a halt, and I thought we would start it up this fall, but with COVID still here, and Arizona's third highest number of cases on a weekly basis in the nation. So I'm not comfortable in doing that, but the format you guys did was perfect. The question I have for you is, you did 2 sessions. One, I think, was on a Monday, the 21st or something.